An American stricken with Ebola is in the air traveling to the United States for treatment. Ashoka Mukpo arrives Monday at Nebraska Medical Center in Omaha. He was working as a freelance photojournalist with the American television network NBC when he became infected. NBC has been reporting about Ebola in Liberia. The rest of the crew will also be flown home separately so they can self-quarantine in the United States. On Monday, U.S. President Barack Obama gets an update on the American response to Ebola. He'll get that from the director of the U.S. Centers for Disease Control. He's the physician who is also leading the nation's response to prevent a deadly outbreak from spreading around the globe. CCTV's Jessica Stone is live in our newsroom. Jessica, what will Dr. Tom Frieden tell the president?
Well, of course, we know that he will certainly update him on the condition of the Liberian American man that we've been talking about, who's in a Texas hospital now clinging to life with Ebola. As of this hour, Thomas Eric Duncan still in critical condition, and as many as 50 people who came in contact with him are being monitored for fever spikes in the Dallas, Texas area. These include family members who have been moved from their apartment, as well as health workers. In the meantime, we are also hearing calls for stricter guidelines at U.S. airports, and that's something that also concerns Dr. Tom Frieden, the director of CDC, or Centers for Disease Control. Just listen to senior New York Senator Charles Schumer today.
Today, I'm calling on the federal government to implement a plan to beef up protections at United States airports, at U.S. ports, and at our hospitals. Let me repeat, you can never be too careful when it comes to something like Ebola.
Schumer wants every passenger coming into the U.S. from Ebola hotspots screened for temperature and asked to answer a list of extensive screening questions about possible Ebola contacts. Schumer wants a list of screened passengers then transmitted to area hospitals. But Dr. Tom Frieden of the CDC cautions that shutting down airports around the world completely could actually increase the spread of Ebola. Here's how.
So it's really important, not just to Africa, but to the U.S. and the world, that we stop the outbreak. And to do that, we need regular travel. We need the countries not being completely isolated from the world. I understand there have been calls to shut off all flights. This would be very damaging to the countries. It would be very damaging to the ability to get help in, for people to be willing to go to help.
Susan, we also have some very good news to report on 3 other Ebola-related cases in the United States. Doctors say a Massachusetts missionary doctor who checked himself in back into a hospital in Massachusetts with a cough and a fever after beating Ebola is now in the clear. Dr. Richard Sacra is being kept in isolation, however. And 2 local patients here in Washington, D.C. that were taken to area hospitals with Ebola-like symptoms have also been cleared of Ebola. Plus, a New Jersey airplane passenger who caused an Ebola scare on his plane has now also been cleared of the disease. Back to you.
Jessica Stone reporting live in the newsroom. Thank you for the update on that.